Hey everyone, and welcome back to MedFluencers Unscripted. My name is Dr. Adam Goodkoff. I'm joined by Jordan Litherland here from MedFluencers and a very special guest today, Dr. Ricky Brown. Dr. Ricky Brown is the real TikTok doc on TikTok and on Instagram, Dr. Richard J. Brown. Ricky, thanks for joining us.
Thanks for having me. Appreciate it.
So we're going to get into a whole bunch of stuff. You deserve a
Yeah.
much longer introduction. Jordan pulled together some notes. I mean, plastic surgeon, social media extraordinaire, the author of the Real Beauty Bible, which I'm actually really interested to get into, hear your experience from that. And you're West Coast, right? Where are you based again?
Yeah, I'm in Scottsdale, Arizona. Grew up in Georgia. I'm a Southerner, so I'm an Atlanta, Georgia boy, and then made my way through the Midwest for med school, and then eventually came out here to set up practice.
Well, you answered my question of how you got there.
Yeah.
One of the questions, and we have a whole host of folks that listen to these from various backgrounds, but I think something that's always interesting, people have a preconceived notion of what plastic surgery is. What got you in that direction? Why choose plastic surgery?
It's a good question. So I was in general surgery. I did a complete general surgery residency. So I'm board certified in that. I've maintained my boards there. And it was in the middle of general surgery that in Chicago that some of the plastics residents from Northwestern came over to get their trauma experience because we were in a level 1 heavy trauma center, inner city, right down the street from Cook County in Chicago. So you can imagine what that was like. And I was finishing up my 3rd year, and this was back when there were no work restrictions. I was working 120 hours a week. I was tired. It was crazy. It was insane. If I wasn't sleeping, I was working. And these guys were like, "Hey man, you should come in the lab with us next year. Like we're doing research in Dr. Musto's lab. He's the chairman of plastics. It's wound healing scars. It'd be a good break for you. And we think plastics is really cool, right?" So I decided to do that. And in leading up to that, from the trauma standpoint, I got to experience a lot of plastic reconstructive surgery stuff because our trauma patients just needed those services. So I broke out from Mount Sinai and headed over to Northwestern for a year to do research. And it was during my research here that I was like, man, I started to look at lifestyle and what I wanted my family life to look like, what I wanted my whole day to look like when I was in practice. And I knew I wanted to be in private practice. I did not want to continue in academia. And that I had done for a while when I was in the lab and published a bunch of papers. So kind of halfway through my research here, I was like, yeah, I think plastics is going to be what I'm going to do because I was attracted by being able to operate on children, cleft palates, cleft lips, all the cranial stuff, being able to operate on adults, being able to do breast cancer reconstruction, being able to do cosmetic. It just seemed like such a broad, diverse surgical field that I could kind of find my way and carve my path for how I wanted my practice to look like, rather than being pigeonholed into ER call with appies and colons and diverticulitis and bowel obstructions. I just didn't see myself enjoying that. And so that was my natural progression into plastic surgery.
So your work hours are really on your terms. You set your schedule when you're in the
Yep.
office.
100%. I'm solo practice right now. Eventually, I'd like to grow that and change it. But I've been in solo practice since 2009 when I moved out here. I set up shop with an older guy who was about a year from retirement. And he literally walked away after a year and said, "Hey, man, it's all yours. Whatever you want, you tell
Wow.
me, and you can keep it. Whatever you don't want, I'm going to sell it." And he literally just kind of helped me get busy doing Mohs reconstructions and skin cancer stuff and some breast cancer. And then he just stepped away. So I've been solo since day one, and I set my schedule. And that was one of the attractive things for me about private practice was it wasn't so much about making money. I mean, of course we all want to make money, but I wanted to dictate my life. I didn't want to be dictated by the administration, what I could and couldn't do, how I was going to run my practice, how I treated patients. I wanted that to be on my terms. And
Mhm.
that's really why I went into private practice.
I love that. And I want to dive in on hours for a second because I think you and I can commiserate over this, but I can't say 120. I mean, I was in the new work hour restrictions, right? We did a
Yeah.
lot of hours. We certainly, it's sometimes you're maybe not reporting all of them. And trauma is one of those times where the hours are just insane.
Yeah.
What was it like for you during that time?
It was chaos and it was a huge blur. And I don't necessarily think that way was the right way, but I will tell you that I think I definitely learned a lot from being in the hospital, as you can identify with. If you're not there, it's really hard to learn. You've got to be in the trenches experiencing that stuff at 2 and 3 in the morning that goes down that you just don't get to see during the
Totally.
day. So it was pretty chaotic, man. I mean, but we had each other's backs. The general surgery residents, like we helped each other with central lines and checking x-rays and chest tubes, checking films for trauma patients. So it was pretty insane, man. But I will say I had a really good time. As crazy as it
Yeah.
was, my only existence was medicine and learning how to become a good surgeon. And so I wasn't married, I didn't have kids, I wasn't dating anyone, and I was like, this is it, man. Like, this is my time to just absorb all that I can. But it was chaos, and I had the work change. So you guys are at 80 still a week, I think is the max.
80 rolling average. Yep.
So that for me, I think the lab year was the year that switched over. So when I came back after my 4th year, I was like, what? We only work 80 hours? Like,
Yeah.
oh, this is kind of cool.
Right. You're like on vacation.
Wow.
Yeah.
But at the same time, it was hard because we had students who were like, I'm supposed to go home at 7:00. And we had residents who were like, I'm not supposed to be here. And that was hard for me because I was like, what? Like, you own your patients, you take care of them until it's time to leave. And there is a time to leave, but like, you don't sign out your chest tube x-ray to another guy. You go check it and then you can leave. That was the way that I grew up.
Totally.
So,
yeah. I think it's interesting because there's merit to both sides of that. And we could probably, we won't go too far down the rabbit hole on this, but I'm curious kind of your thoughts on the work-life balance component. Because a lot of folks now, I see this actually all the time on social media. Someone will say, hey, I was a general surgery resident and I left. And I think we hear that more and more like in the culture, because it is so difficult, and you're being asked to own exactly those relationships. And on one arm, it totally makes sense. They're your patients. You're the surgeon. You need to be with that continuity. But on the other arm, it's like, where's the wellness balance? And to your point, you didn't have kids. You weren't married. There's a lot of freedom in that element of life. But what about those who do? What's the trade-off there? I don't know.
Yeah, look, I have a point of view about the work-life balance thing. I think that much of the world has it wrong. There is no balance. You can't. There's nothing that's in perfect balance. Things can be in harmony, but if you're going to be good at anything, there has to be imbalance. You have to skew yourself towards diving into the thing you love and the thing that you want to be good at. Now, should that be at the expense of being with your kids and raising your family? People would call it work-life balance if I say, hey, I have a great family life. My wife and I have a great relationship. My kids know who I am, but then I'm also at work. But that's not in balance. I'm definitely more skewed towards making sure I'm a good doctor and making sure that I'm taking care of patients. But I also make sure that I spend the time with my wife and I spend the time with my kids and we do Jiu Jitsu together. So I think that people need to understand that there is no real balance. It's an imperfect imbalance that we have to have. But you have to decide which way you're going to skew it. Do you be less good as a physician and you're more with your family because that's important to you? Or is it more important to you to be a better doctor? And I think that changes as we get down the years of being a doctor, right? Because I don't have to work as hard at being a good doctor now because I've been doing it for so long. Yeah. But in the beginning up front, it was for sure imbalanced for me. I was spending more time operating, late nights at the hospital, diving in, trying to recruit people to come to me for services to take care of them. So, and then I think as the years have gone by, I've had a little bit more balance, but it's still, I think, an imbalance because I'm still at work a lot.
Yeah. But I'm curious, do you have like a morning routine where you get your workout in at 5 a.m. and like that sets the tone for the day?
1000%. So I start every single day off with some type of exercise or workout. I do take rest days, like, we all need to do that. But my wife and I are doing 75 hard right now. I had to quit that because of my burns on day 48, and I've done it 2 or 3 times, but we just started it back last week. So we get up at 4:30 and we go for a 45-minute walk together. And then I'll either go to Jiu Jitsu or go to CrossFit. I've been a big CrossFit person for a long time. I am a morning workout person. For me, that is my Xanax. I don't take pills. That is like I don't understand people that don't like to exercise or move their body.
In the morning, I have a hard time.
Yeah.
There you go. You've met her.
And a lot of people, now she likes to work out, but not in the morning.
I
don't get people who don't like to work out and don't like to move because to me, I think it's hard to get started on that path. But once you do, you miss it if you don't do it. So like when I can't work out, I don't feel complete,
Yep. Yeah, I'm right there with you. I have been traveling a lot, and it kills me. I bring my running shoes, and that's the saddest part. I see them in my suitcase, and it's just like the hours. I suppose, we got 120, maybe I'm undershooting, but I get back to the room. It's like 1 a.m. and I'm like, I can't go for a run. I just have to sleep. And the same thing, you're up the next morning, then you're back on a flight, and it is so great to be back home on these times where I am here and go run. Now I was saying earlier, I'm in New York now. I get the pleasure of running either in Central Park or along the East River. It's like beautiful. And so I miss those
beautiful.
when I'm not
My
home.
sister lives on the Upper West Side, so I spend some time in New York and I love it. So Jordan, are you an evening worker outer? Is that your jam?
I'm an evening worker outer, but I've noticed that I'm a better partner to my fiance, like probably a better coworker when I work out. It's such a stress relief. So in
Yeah.
the morning, the whole tone of my day would probably be completely different. I just don't want to get up.
That's what most people's problem is. You know what though? I go to bed early now. Literally, my wife and I are in bed between 8 and 9. And I used to be a midnight
Nice.
guy. Up until a few years ago, my wife was like, we need to start going to bed earlier. And when we started doing that, getting up at 4:30 for me now is not that big of a deal. I really
Mhm.
never thought that I would say that. 5, I always used to always be like, anyone who gets up before 5, there's something wrong with you. And now I'll get up at like 4 sometimes, a lot. And I just can't believe that I'm able to do it. But it's because I go to bed early.
Yeah, I'm right there with you. I actually made that shift a couple years ago, and I'm not quite as early, but my fiance as well is she's a anesthesia fellow and doing acute regional right now, and so she's up crazy early going to the hospital, and so I was like, well, we'll get on the same schedule, so we're up at 5, and I get my run in and everything. But same thing, I've been trying to go to bed by 10 or 11 at the latest, so you at least get some
Yeah,
quality sleep in there. So
Yeah.
for
And
sure.
Dr. Brown, I want to backtrack. How did you get into jiu-jitsu?
Okay, so my boys started doing it about 8 years ago, and it was a bully proof program with Gracie University, which are two of the Gracie sons broke off and started this sort of anti-bullying program for kids where they learn jujitsu, but it's from the self-defense standpoint. And so I watched them on the mat for several years, and I was always like, man, I want to do this, but like, I don't want to give up CrossFit and I don't have time. And that I played that song in my head for a long
mhm.
time. And Adam, the guy who owns the school, would always be like, when are you getting on the mat, man? When are you getting on the mat, man? When are you going to get on the mat? And so one day I just went in and did a class, and I was like, wow, that was really awesome. And then I fell back into my pattern of, I don't know how I'm going to do it.
Yeah,
I don't want to give up CrossFit. And then finally one day it just clicked, and I took like a couple more classes, and I was like, okay, I'm in. Like I can give up a day of CrossFit because I don't
Yeah.
need to
yeah,
do that 5-6 days a week. I do it 3 now. And
sure.
so as I started doing it and learning self-defense and then learning jujitsu, I got hooked, and I've been doing it for about 2 years now.
Now, do you
Nice.
compete or is it just for fun?
No, I don't compete. I mean, I got my blue belt in December, which was a huge thing. And I got my first stripe this week on my blue belt. You get
Congrats.
4 stripes on a belt, and then you test for your next belt. That's how it works. Um, for me, it's more about, I was like, I want to be able to defend myself. I don't really have a desire to compete. And I want
Hmm.
to just get good at jujitsu because it's like playing chess on the mat. You literally have to play chess. And of course, I get worried about hurting my hands and getting hurt in there. But what I like about the Gracie University method is they teach from the standpoint of, we're not just going to throw you into a gym and expect you to start grappling with like brown belts and purple belts, and you're just going to get crushed. And hey, man, eventually you'll figure it out. Like you'll be okay. The way they run their system is there is a self-defense curriculum that you have to go through. And each class is a standing move and a ground move. And then you practice with another guy or a girl. And that's the class. Like you'll maybe grapple a little bit at the end, but the first self-defense section, which could take a year to get through, is just a very controlled, non-threatening, non-aggressive exposure to jujitsu. So after doing that, I was like, oh man, like I'm in. I kind of want to like fight a little bit now, but I
Yeah.
just have no desire to compete, you know?
Yeah. It's funny you mentioned that because I was back in college and someone had, got me to a trial class, but it was the opposite experience. And it
Yeah.
was, they're like, we're going to teach you the, I think it's like the top mount or something like that. And then whatever, where you got your like knees and you're using your hips. And then like 10 minutes later, they're like, all right, have at it. And like, it ended up just being me and my friend just going 100% for like 5 minutes till we both couldn't
They
breathe.
were
And it was
like,
just
Which
like,
is
sink or
always
swim.
bad.
yeah. And
But
then I was like,
that's what I love about Gracie University. Anyone who's looking to start it is Henner and Hedon Gracie decided we want to bring this to as much of the world as we can and make it non-threatening and non-invasive. And that's exactly what their programs are. And they get a lot of slack for doing that, but I think they're doing a great job at bringing more people in a very comfortable manner.
I love that. I want to go back to hours for 2 seconds. And it won't make you relive residency, but
Yeah.
I'm segueing into the social media side because you and I can appreciate the amount of time that it takes to create content online.
Yeah.
You balanced things in residency, then you went on, you had a life you're attending. What brought you back? What made you want to come on and give up time away from jiu-jitsu, away from CrossFit to come back to social media? Tell me about that journey.
I think when I started on the gram back in like 2016 or 14, I didn't even really know what social media was. I don't even think I
Sure.
was like, someone in my office was putting up, now I know, memes that were like quotes and stuff. And I
Yeah.
had to have back surgery in 2016, and I was laid up, and I was like, all right, like I need to start, like all these other people are doing stuff on Instagram. I need to start showing surgery, and let me, because I saw it as a way to educate. I've always, you can appreciate this, right? Because you love to teach students. I'm sure that you teach, right? And
Yeah.
you like to teach residents. I always loved teaching residents. And so this was my way to start educating the world about what I do for a living and showing before and afters. And then it turned into, you know, helping pre-med students out and trying to be motivational. And so what brought me into it was, as I realized this was my way to advertise for free, not only my job and what I do, but I could also help people not get botched, right? Because that's such a huge thing in my industry, is I could help guide people towards the right way to have some type of surgery. And that's really what brought me in. And then you know how it goes, right? Because you and I did, you worked with me, and we did a day in a life at one point a long time ago on YouTube.
Yep.
And that was really when I was starting to get into social media at that time. I was kind of in it then, but it wasn't until TikTok hit that I really went hard, I feel like.
Yeah.
Yeah. And I was just about to say, with the rise of social media and even celebrities out there, you're always seeing these different procedures that are getting done. I'm sure that's hard for you to navigate with patients saying, oh, I saw Cardi B get this done and I want
Yeah.
this done, which it may or may not be the right fit for that patient. So talk about navigating that with the rise as well, and just
So
everyone comparing themselves.
I think the hardest part for me as a plastic surgeon is that everyone on social media thinks of what they see portrayed by Hollywood and all of these huge stars on Instagram and all the other social media platforms. And I don't think people realize that's not what most of us do. Most of us that are plastic surgeons are not overdoing lips and overdoing breasts, and we're not getting crazy and doing 6 BBLs on one person. Like, that's just not what we do. Like, I'm an ethical surgeon, and I believe that plastic surgery has its place, cosmetic and reconstructive, obviously, for everyone. So it gets really hard to navigate on social media sometimes, because it's portrayed as like this huge, let's overdo plastic surgery, and you should never want to do anything to yourself, because why can't you just love yourself the way you are? And let's face it, like a mom who's had 4 kids and they just want their breasts to be a little more tight and high and fit in their clothes better again, there's nothing wrong with that. Why do people get tattoos? Why do you put makeup on? It's because you're wanting to look and feel a certain way in your body. And I think that in social media, the problem is it's gone completely the other way, where everyone is just like so negative about anything that's plastic or cosmetic, and don't realize that there is a place for everything, as long as you have ethical, sensible surgeons out there doing it. And I think what's happened is you have a ton of non-board certified plastic surgeons botching people, and that's what we see all over the internet. So everyone just assumes that every plastic surgeon is that. You
Yeah.
know?
I want to, and I don't want to create internet drama, so we'll stay broad. But I think there's some, like I watch from the sidelines, right? And there are some surgeons who seem to love to kind of jump in or take credit for celebrity procedures, or almost reference that, like, maybe I'm the one that did that.
Yeah.
Which feels like it flirts close to HIPAA violations. So tell me, like, walk me through that. I know like plastic surgeons are posting results all the time, but what's your take on that whole situation?
Yeah, you do have to be careful. I do see some of the joking posts, like, and I've made those before, where it's like so and so taking credit on the red carpet and telling their trainer helped them when it was, yeah, I see that. But I think you're talking about, people really kind of really hinting that they were the one. And I think it's unethical. I think a lot of times it's for clicks and views, and that could be a
Right.
problem. I mean, technically speaking, if I operated on Kim Kardashian, I would never even hint that I did.
Of
It wouldn't
course.
be appropriate for me to do that. It's not okay for me to do that. I don't need the clout from anyone to do that. I have operated on some high profile people, and I've never even hinted or said anything about that. And that's the doctor patient relationship. So I do believe that unless the patient is given permission for you to admit that you shouldn't even hint towards that. And I think we all know in social media today, a lot of that's for clicks and views.
Yeah.
And I know you and I align on the topic, which is why I think it's worth bringing up. But it is interesting in understanding, like, the span of digital opinion leaders or physician influencers out there, right? And how they choose to interpret and interact with that, right? And I agree with you 100% that it's like, that's the person, that patient's private information, and what HIPAA or not, it just doesn't feel like something that we should be leveraging for clicks, but it's definitely out there. And I think that's one of the interesting things in the plastic space, is like everyone is trying to be almost a celebrity in a way.
Oh, for sure. And even on my page, if you notice, I don't hardly ever post any before and afters on my Dr. Richard J. Brown page because
Yeah.
it all gets shadow banned. I mean, it's kind of frustrating. I used to be able to show all that stuff. And then I was like, I had this crossroads on my social media where I was like, what do I do now? Like, I can't really talk about plastic surgery. I can't even talk about injections. If I type the word injectables, it gets shadow banned. If I show
Oh,
a
wow.
before and after, even with covered nibbles, like I can't do that. So that's why I started doing more medical reactive content because
Yeah.
I was like, I want to be on here and I want to help people and I want to teach, but I also want to be funny and joke, but I can't show plastic surgery. So now what do I do? And that's really been the toss up for me for the past several years, because let's face it, you guys know, right? If you don't educate, entertain, and inspire on there, no one's gonna see your content. So
Right.
me being a talking head and just being like, let's talk about breast reconstruction today. Like people just they don't
Yeah.
want to
Yeah.
see that.
No,
That's not
you're
what,
you're spot on. Yeah,
you
it's a
know?
challenge, right? And I always say it's hard to what really makes a good digital opinion leader is someone who can balance that ability to tap into the qualities of what makes a viral video, but still be really educational. And I think you
Yeah.
do a fantastic job with that. And I think it's a fine line to walk because you do, your physician brain sits down, and you're like, oh, let me talk through the pathology. Let me explain why this is the pathophys behind it. But we need to be engaging. We still have to fight for people's attention. And it's really interesting, when you look at someone who's giving up their time to make content on social, and then you're almost having to gamify your own education and figure out a
Mhm.
way to get folks to listen to help them. So it's an interesting process. I
It's
want to
hard.
segue. It is tough. I want to segue for a second though, and we'll ask permission first. Although you did post
Yeah.
about it, can we jump into this burn injury?
Of course.
So no intro needed, right? You have given. We'll probably overlay a little clip here if we have some video, but walk me through. Give me your version of the story here. I am sure that the listeners want to hear from your mouth what happened because it
Yeah, for
was
sure.
wild.
And I'll preface this with the hardest part of this whole thing was being a plastic surgeon and having worked in the burn unit as a resident in general surgery and plastic surgery. I knew exactly what was coming, and that was the hardest part of all of this. So what happened was we have a new flat top grill out in the back because I love making smash burgers. I've been grilling my whole life and I've never had a problem. And it's in a built-in island outside. And there's a propane tank underneath because we don't have a gas line. It's like $5,000 to get a gas line run to it. So I've had a propane tank. So I go to light the grill, and there's a very small space between the top and the burner, and you can't see if it's lit. Like when you open up a grill and you can see that it lit.
Mm-hmm.
It
Mm.
sounded like it lit. So I walked away to let it preheat for like 5 minutes, and I came back and I felt the grill and it felt pretty hot, right? But it's 110 in Arizona in the summer, 120,
Yeah.
and it felt freaking hot. And I thought that
Yeah.
I could see some of that heat coming off the back of it.
Yeah.
My wife like poked her head out and she was like, "You gonna start grilling?" I was like, "Yeah, I'm about to start." She's like, "It smells funny out here." And I was like, "Yeah, it smells like gas. Crap." So I turned it off. I was like, "It must not be lit." So I walked away thinking, hey, let me just give this 5 minutes or so to let whatever's sitting underneath the steel surface to dissipate
Right.
and go away, and I'll be good. So walk back over, and underneath where the tank is, there's two metal doors to the island. And I'm just kind of standing a little off center. My right leg is more in front, my left is a little off. And I go click, and it explodes into my legs. Just a huge loud boom, a big fireball. Like between me and the kitchen, right behind me was a very small space, and they were in the kitchen, and all they saw was a huge fire blast. And so I immediately looked down at my legs, and all the skin, the epidermis is just hanging off of my legs.
Oh my
Oh,
And
gosh.
of course my burn brain, I'm like right into the swimming pool. So I turn and go get in the swimming pool to cool them off as fast as I can.
Yeah.
I
Yeah.
get out, I don't see, and of course I'm like Parkland formula. For those of you who don't know, there's a formula for resuscitation and how much volume you need, and you calculate your percentage burned. And I'm like,
Yeah.
that was just my brain started kicking in. Like, how bad is this?
Oh man.
So I get out of the pool and I look down, and it's all pink and red, right? So that's like a good sign. But the
Sure.
problem with burns is they can evolve to deeper burns over the ensuing days. But at that moment, all I was thinking was, okay, it's all pink. It looks like second degree. Like,
Right.
I'm going to be okay, but ouch, you know?
Yeah. Yeah.
Yeah.
So we just called the fire department to come over really quick because there was a little fire underneath there. Now, mind
Oh,
you, the
yeah.
tank did not blow. If the tank had blown,
Oh my God.
I would be dead.
Yeah.
I'd be dead. I would be dead. It was literally standing this close. It was right in front of me. It would have exploded everything out. It would have thrown me, and I either would have been in the unit still intubated probably, or I
Yeah.
probably would have been dead.
And I'm
So
assuming there's no ventilation or anything in
so
the
that's
back.
what happened. So in hindsight, learning a lot about this process, there were no vents in our island. And so anyone who knows anything about gas, propane gas is heavy, so it goes down. So what happened is when it was all priming for 5 minutes and I thought it was lit, all the gas was siphoning down into this big long island that I had no idea. The gas had nowhere to go because there were no vents cut into the island. And so when I ignited it, it all just blew, and it blew into my legs. And I would have been none the wiser. I didn't know, like, oh, should I open the doors and let it air out? Like, I
Right.
wasn't even thinking that way, and I thought I was blaming myself for a little while. And then every time I told the story to someone, they're like, I would have never thought to open up those doors.
Now knowing the outcome, I would think of it, but I
Yeah.
wouldn't have thought of that originally. And I don't know. I mean, I'm no gas expert, but if it's heavy and it's below the doors, would it have even come out? Right.
It wasn't even that it was below the doors. Like, imagine the island is here and it extends all the way down about 5 or 6 feet.
Oh,
And
okay.
everything inside is an open space. So it just
Oh, wow.
filled that entire thing with gas.
So you made like
And it was
a
mostly
gas bomb.
centered under the grill. So
Yeah.
there's gas in the whole thing. And it's basically cinder blocks that are stuccoed around with a granite top on it. Right. And this
Yeah.
was before we bought the house. Someone else built it.
Sure.
And I never learned if code was to
I
have vents cut in it or not.
I was just
Right.
about to ask, is that up to code? Have you
It probably is not, to be honest with you.
Yeah.
Whoever built it probably hired some people off the street. They probably never pulled permits. They probably built it to match the house and then
Yeah.
moved on and didn't think anything of it,
but I'm sure you don't want to go down that rabbit hole.
No, I mean, look,
No.
people kept telling me I should sue someone. I'm like, number one, who am I going to sue? Am I going to go
Yeah.
find these people on the street that built it? And number two, if I
Yeah.
even find the builder who did it, which I probably won't because it was built so long ago, I'm like, what? Like, that doesn't help anyone. Like,
Sure.
legally, it's not like I'm okay. And I was down. So I was down for about 2.5 weeks, and we could talk about that recovery process if you have questions
Yeah.
about that.
I mean, I'm just so curious as a physician then to be in the patient role, like just the kind of mind
Yeah.
games that is and how trials there.
It's pretty insane. And I've had multiple operations. I had a total hip replacement about 1.5 years ago for a congenital problem. So I've been the patient, but this is very different. What was very different about this, it's very lonely, right? Like, you're in the hospital and we as doctors are there for people to help them and to help take care of people. And
Totally.
even though I knew they were there for me, it was very lonely. Like, you're in pain and the pain wasn't that bad. It's weird to get this emotional. It's been 2 months and I don't
Yeah.
have any PTSD from this, but it's just a very real, raw moment. And when you're laying in the hospital and like the nurses don't come in for 3 or 4 hours, or no one comes by to say hi or to make sure that you're not in pain. And I will tell you, the Maricopa burn unit is amazing. But one of the nurses I had first, he never came in. He came to see me and put in an IV and disappeared the first night I got admitted. And I never saw him. And I was like, it was just very lonely, a very lonely feeling. And I started to feel like, wow, this is what people feel like. You almost feel abandoned as a patient sometimes when you just want someone there to tell you it's going to be okay. And even though I knew it was going to be okay,
Totally.
it was real. That was probably a hard part for me because I was only in the hospital for like a day and a half to have a procedure.
Mm-hmm.
But that was really weird. And
yeah, it's funny. It's not funny. It's probably a poor transition word, but like going back, I had a similar experience. Thankfully, nothing exploded, but I had like a repeat surgical incident. I ended up being admitted to the hospital. It was actually, it's not a secret. I had like a tonsil surgery in medical school, and it was revised. And ended up having arterial bleeding, and I was like showing up to the ER just like pumping blood out of my face. And it was the same kind of thing. I mean, I wasn't a physician yet. I was in medical school, but like I knew there would be a solution. But I just remember every time going back to the OR, nobody was focused on me, and appropriately so, right? There's like an airway issue and everyone's worried, but
right.
I just remember like I was laying there bleeding and they're like, I don't know if we can intubate him sitting up. And I just like laid down and they must have
You're
pushed
like, what?
propofol, but I'm like, just like choking on blood, like alone, and I have the same, it's been longer, much longer for me, but when I was admitted, I had the same very visceral reaction. Like it was just like overwhelmed with emotion because you're just alone sitting there. I remember the feeling is the only time I'd ever had narcotics, they would push morphine and it would feel like I got rolled over by a steamroller for whatever reason. Like my whole body felt like it sunk into the bed, and then you wouldn't remember stuff for a while. And so I can commiserate with you over that. And it is wild. I think really it's a huge not that everyone should experience this, but it is a huge like compassion driver on the way that I give care and
Oh,
interact with
I
yeah.
was going
patients
to
now.
say that probably completely changed your outlook when you were
It
back for
did.
both of you.
Yeah, I mean, I'm a very compassionate doctor to begin with. That's just my persona, but my perspective is a bit different now.
Exactly.
I have a much lower threshold for how is this person feeling right now in this moment. So if I get a phone call that maybe originally I would blow off and be like, that's so not a big deal. Like, you're going to be okay. Like, I don't treat them that way, but in my mind that way, I would be so different in that conversation now.
Right.
And it definitely changed my perspective a little bit. And just being on that side of it, having a better appreciation for people who are going through cancer and like spend years fighting disease. And mine was such a fleeting 2-week healing process that I can't even imagine what people go through that are really, really suffering, you know?
Mhm.
Yeah, that's really well said. And I want to tie in also because I think I had actually reached out on social, so I'm guilty. I probably should have just texted you. But how was your experience? Like, because we're really kind of, I call it like a big community of these like
Yeah.
healthcare influencers, DOLs, whatever.
Yeah.
Did you get a lot of folks reaching out, or was it more folks kind of from the side, just
You guys, everyone stepped up massively for me. I had hundreds of DMs from doctors, followers, random people who saw it, sending me like, I'm not a very religious guy. I had one woman literally like dictate a prayer for me.
Wow.
And I was like, look, I'm not super religious, but this is huge. I will take it. And so every day she would write a prayer for me. And
Wow.
she would like send me a prayer, and people just sending us stuff from flowers to cookies to phone calls. And it was really, really heartwarming to be able to see that in that way that I give back to social media people, to followers, and to other doctors and all of us that have met each other on social, that
Right.
everyone stepped up and really, really showed me a lot of love. And that was huge, right? Because I was laying in bed and it was
Right.
really nice to read all of the nice comments. It was very helpful for me.
But I
was
think
very
it's a
helpful.
testament to you too and the community you've built on your social channels.
Yeah. I mean, yeah, I'm guilty of, I'm oblivious to my presence on social media. I'm literally oblivious. I feel like I just like make stuff and kind of go about my day and don't have any idea of the impact it may or may not have on anyone.
Yeah.
But that showed me something huge. And
Mhm.
it was really, really cool to have that, that love.
Yeah, and if I didn't say it before, I don't think if any of the listeners aren't aware, Dr. Brown has almost 10 million followers. I think we said it's like over 9 million followers across platforms. So you have clearly made an impact on literally millions of people across the world. So I think that's really nice to hear that, people did kind of interact and come to your support during that time. So
Yeah, big time. And I read every single message and I responded to every single person. Like
That's
that was
awesome.
my mission. I was like, if I'm laid up in bed and I can't really do a ton right now, I got out my iPad with the keyboard because it's easier to type and respond. And I literally read every single person's message from the inbox to the ones that go not in the inbox. There were a lot of people in those that were also trying to reach out to me. And I just tried to respond to everybody, at least to acknowledge that I got their message.
Yeah.
And then some people had conversations with, but yeah, no, people
for
showed me
you.
the love. So for all of you out there who are watching this, if it was one of you, thank you from the bottom of my heart. It was really cool.
That's amazing. Well, I appreciate you sharing that story. I want to put closure on it. How are you doing now? How is the healing going?
Amazing. I mean, I legit healed within 2.5 weeks. So we were on my right leg. There were areas of deeper partial thickness that were second degree that we weren't sure we're going to need a graft or not. So they admitted me to the hospital about 4 or 5 days in to go Versajet it, which is a device that kind of strips the top layer of skin off to see if things bleed. And she's like, it has like a C- like bleeding, but I don't think we need to kind of start carving it up and putting grafts. Let's just see what happens. So I went home with dressing changes, and a week later, she was like, okay, things look like they're progressing. I'm still not sure we're out of the woods. And that was about 10 days out where I had finally made the decision to go do hyperbaric. I was doing exosomes. I got peptides. I did IV vitamin drips. Like about 10 days out, I committed to 10 days of hyperbaric treatments.
Wow.
And my wife was doing my dressing changes. And I'm telling you guys, literally within 2 days, she was like, it is healing, like you're reepithelializing already. Like, and I don't know if that's because 10 days was about the time that was supposed to happen, but I truly, truly believe that hyperbaric really pushed me over the edge to not have to get grafts. And so probably around day 15 or 16, I went back to the burn clinic and she was like, can I cuss? She was like,
Yeah.
Holy shit.
Yeah.
You're healed. Like you were healed. I was like, I know. I'm like, I was healed 3 days ago. I'm
That's
like, I've only been
amazing.
doing your dressing changes because I thought I should just do them because you told me to do them and I want you to get mad. But literally within 12 or 13 days, I was completely reepithelialized. And there was
Wow.
a point at which I couldn't, it was hard to walk. It literally felt like my calves were the size of a tree trunk. And
And
it
I,
felt like you were literally tearing the muscles with every step that I took, but I had to do it. And
yeah.
literally by like day 15 or 16, after everything reepithelialized, one day I was like, oh, this doesn't hurt as much walking. Then the next day I was like, holy crap, like I can actually stand up. And
Yeah.
then like within like maybe just under 3 weeks, I was driving, going back to the gym and just kind of light working out and doing whatever I wanted. So I healed in under 3 weeks.
Wow.
It's
It was
amazing.
insane.
Jordan, for the reference of those who might not, do you know what hyperbaric is? Should we talk about that real quick?
Yeah. I mean, I at a high level, but yeah,
Right,
if you
right.
guys want to expand on it a
It's
little bit
so
more.
Ricky, what kind of chamber were you in? Because our residency, I was in Chicago, and we had the dive chamber for Chicago. So, but it was huge. I mean, you could dive multiple patients and walk in. It was like a little submarine. This, I'm
Yeah.
assuming, was maybe different.
This was a one person. So it's an
Yeah.
acrylic tube.
Mm-hmm.
And the bed slides into the acrylic tube and they have a TV so you can like literally watch Netflix while you're in the chamber.
Nice.
And for the people who don't know what hyperbaric is, you essentially breathe a 100% oxygen rebreather mask and they put you down to like 35 feet. And that what that does is it drives pure oxygen into the tissue to help to oxygenate the tissue and help it heal faster. We use it in, decubitus bed ulcers and burns and people with wounds, diabetics who don't have good blood flow. It really helps to drive blood into the tissue to heal. And so it's a big thing in burns. And they have the chambers like you're talking about where they'll put like 8 people in a chamber and send them down. But you spend an hour, I spent an hour in the chamber and they took me to 2 atmospheres, which was about 38 feet or something like that for an hour. And then they bring you up and your ears are popping and that whole thing.
Yeah.
But dude, it's probably the most peaceful time that you'll ever have in your life.
Right.
It's quiet. It's just so relaxing. I thought I was going to be claustrophobic, but it's an acrylic
I know,
tube so
that's
you
what
can
I
see
was
outside
thinking.
of it. My wife did it just to do it with me one day. Like she came in and did a treatment next to me. And there were 2 tubes next to each other.
Oh,
That's kind of cool.
And a lot of people do it. There's a lot of regenerative medicine play behind it that it's good for the brain. And there's a lot of regenerative medicine. People push it.
Now I'm curious though, did your doctors, were they recommending that or did you just kind of explore that on your own based on your expertise?
Yeah. What's interesting, Jordan, is my surgeon, who was amazing, by the way, I want people to know that every nurse I had down at Maricopa County and my surgeons were incredible. I had that one experience the first day. Everyone was amazing. So my surgeon, I mentioned it to her and she was like, she's like, for sure. Like it won't hurt. I don't know that the literature supports it. It's going to keep you from needing skin grafts. I'm not telling you not to do it, but I'm not telling you that it's like, it's going to save you from grafts.
Yeah.
And I was like, whatever, I'm doing it. I was like, okay, I'm doing it. And I don't think she was wrong for telling me that because the literature is not 100% clear, but it's pretty obvious that it helps wound healing. And maybe the literature is not clear that it doesn't help a second degree not convert to a third degree. But in my mind, I was like, I am not getting skin grafts. I am doing this and I am not going to get grafts. And that's exactly what happened.
Yeah, there's a lot of mind over matter. I mean, it sounds like you had the right mindset from the start. And obviously,
and my health status.
Yeah.
I mean, I don't know if you saw me talk about this on social media, but I think the fact that I was super healthy before 100% contributed to my ability to heal as fast as I did. And so I am really trying to tell people who are listening to this and people on my social media that I want this losing weight, exercise to lose weight thing to go away. I want people to focus on getting healthy and living in a healthy body so that when disaster hits, your body has resilience to heal. And that's exactly what I had from CrossFitting for 11 years and for working out and staying in shape. My body was resilient and able to take on the stress of what happened because of the shape that I was in.
I couldn't agree more. And I think that maintenance health, that kind of like baseline level of health is huge. Resilience is a great word for it. I think you're kind of actually segueing well into our last little part of this MedFluencers Unscripted. And we like to ask from your specialty lens, is there anything that you would want folks to know? And I think that's a great point. Is there anything else? Is there a leave behind that you'd want folks to know about plastic surgery, about yourself or your career?
Yeah, I'll give you two things. I think when it comes to plastic surgery, I want the world to understand that there's a reconstructive and cosmetic aspect to what we do for a living, and that most surgeons out there only want the best for you. It is okay to want to change something physically about your body as long as you understand the risks that are involved with doing that. And as long as you understand that you have to find the right surgeon. And I understand that it's hard, that not everyone has the money to do it, but there's nothing wrong. A lot of people feel like people who have cosmetic procedures, like for some reason, don't love themselves or don't respect themselves. And I think it's quite the opposite. I think people love themselves, but they just want something to be a little better so that they can feel better inside. So I want people to realize that if it's something you want to do, you have to do your own research. You have to find your own good surgeon, and there's nothing wrong with that. The second thing that I would lead people with is because I'm really into health and wellness. And I think that I am the surgeon who turns people away if they're not healthy enough to have surgery all the time. And I help guide them down that wellness journey to get with a nutrition person to help them get to where they need to be to have the best surgical outcome. But just what I said a second ago, I want people to focus on working out and getting in shape is not about losing weight. That will be the end result if you do it right. If you have a good nutritional pattern and you have really good habits for moving your body, you'll lose weight. It's impossible not to. But I think people need to shift. I think society and social media has become so focused on the quick fix and losing weight really fast.
Yeah.
And I want people to understand that I have been doing this for hardcore for 11 years, and it did not happen overnight. You do not become an overnight success, but investing in your health and investing in your body and treating your body with respect and doing things to it that are only going to promote healing will help you when the rough times hit, because everyone at some point in their life will suffer from illness, and the better shape that you're in, the better you'll recover.
Yeah.
Very
Dr.
well
Brown, you just
said.
motivated me to wake up at 5 a.m. and work out.
See?
We'll see. We'll hold you to it, Jordan.
Yeah.
And we'll check back on the next episode if you're
You're
still getting up.
training. People need to realize you're training your body for the world. You're training
Yeah.
every day.
That's absolutely true. It's like food is medicine, food is fuel. Like putting the right things in and agree, like training yourself, your cardiovascular fitness, your strength, all of those things, I think contribute to resilience. So special thanks again to Dr. Ricky Brown for joining us on this episode of MedFluencers Unscripted. Be sure to follow our LinkedIn page or subscribe on YouTube for future releases. Have a great day, and remember to support your favorite HCPs on social media.